Next up is Yvonne Stroman, another individual that I've known for a number of years as well, and who has great expertise in this field, particularly in treatment. Yvonne Stroman is a community program specialist at the Council of Chemical Abuse. She works with local organizations and individuals to ensure that quality drug and alcohol services are provided. And with community organizations and agencies, she works with them as well to advocate and promote recovery from addiction. I've heard her speak a number of times, and she is also a most compelling speaker. And she will tell you, and it's also in her bio, that Yvonne is a person in recovery for 24 years. Let's welcome her.
Thank you, Senator Schwenk. Good evening, everybody. I just have a small caveat. When that bio was written, it was written in July of 2015, and since then, on August 9th, I celebrated 25 years. And so, I, along with 32,000 other Berks Countyans, live in long-term sobriety, and I really just think that because of the services that are here in Berks County, we are like no other. I travel around the world and talk to people about treatment availability, and what we have here in Berks County really is special. And I can tell you that I probably wouldn't be standing here tonight had it not been for the kind services of Karen years and years ago with this chit chat. But I just believe that miracles work every day at Karen, and some of us sit here and we can vouch for that. So the next several slides, I kind of want to just take you through to talk to you a little bit about the Council on Chemical Abuse, your bridge to drug and alcohol resources here in Berks County. And the Council on Chemical Abuse was established in 1972, so we've been around for a while. And we are responsible for the planning, development, and implementation of resources as it relates to prevention, as it relates to treatment, recovery, and referral sources. We do these efforts so that an individual has the best possibility of getting well. Next slide, please. And so, prevention services are very known in our organization. We do a lot of direct services as it relates to prevention and education, but for purposes of tonight, when we're trying to tackle the heroin opioid addiction, I just really want to kind of talk to you about some of our services and how an individual can access those services if they need to. And so you see here where we provide and manage public dollars. Your tax dollars are very much at work, and we're doing very well. We're providing financial resources for somebody who couldn't otherwise afford it. Having said that, as you can see, we do provide financial support for the Student Assistant Program. We work very closely with care and treatment centers in doing that. We also have an underage drinking program whereby we work with the local district justices to make referrals to individuals that might have got caught for underage drinking or something of that nature, to really begin the educational process for them and make them aware of the dangers of underage drinking. We also provide financial support for family intervention services. Maybe that family needs a little bit of help and assistance about how to get their loved one access to treatment services. And so a little bit of intervention services can go a really long way, and we provide some financial assistance to that. You also heard from the doctor tonight about the overdose survival service, or the warm handoff, whereby we're working with a local hospital to make sure that that individual who was in the hospital as a result of heroin addiction, they have a face-to-face contact with somebody through that warm handoff. You can actually have access to a recovery support specialist so they don't feel alone, and they can begin to work through that process of recovery. Naloxone kits distribution, we're working hand in hand with the DA's office and others to make sure that naloxone kits are available, and we distribute them right out of our office. There is a online training that you must take and bring that certificate into our office, and then we can walk you through the kit, the naloxone kit, and you can have that in your personal home. Next slide, please. And so when it gets to treatment, you can see that there are services that are provided, everything from detox to residential treatment, outpatient services. We also provide public funding for co-occurring services, which are those services that are drug and alcohol and mental health. And then we also provide some funding for medication-assisted treatment, which Dr. Santoro will get a little bit more into when he comes up. Next slide. And so we also provide public dollars to those places where that individual can start their recovery process. Whether that's recovery housing, we invite you to know about information about that. You can talk to somebody from Easy Does It, they're here tonight. Individual support services, as well as early recovery support groups. Those resources are available to individuals who might not can otherwise afford it. Public dollars are available that we work with qualified local organizations to make sure that happens. Next slide, please. So how does one begin to access those services? Because you heard me talk about the Council on Chemical Abuse managing those funds. How can an individual access those services if they don't have their own insurance or access to their own public resources? Well, TASC, which stands for Treatment Access Services Center, they are the licensed gateway to that service that you're looking for. They're located on North 6th Street in Reading. They do performance of comprehensive assessments to identify existence and the extent of use, to determine what is the level of continuum of care that they will need, and to verify the person's eligibility. So Treatment Access Services is that gateway to begin that road to recovery. We do have here tonight several staff members from TASC. Dan Malloy is here, who is the Executive Director. Dan, are you here? Can you just kind of wave? Dan Malloy is here, as well as Bernice Hines, who is a Supervisor of Utilization Management. If you have any questions for them, they'd be more than happy to kind of talk you through that process. Next slide, please. And so, how does one become eligible for the Council on Chemical Abuse funding? Well, there's some criteria, as you can see here. You have to not have your own insurance, private insurance, or any other financial access. As I mentioned, they are public dollars. And you have to be a resident of Berks County for at least 3 months. And you also have to be able to have some level of financial liability, and so that's a state mandated order that there be some liability in terms of your ability to pay for some of the service, and for some perhaps you cannot, but those criteria, they will help you evaluate that task to see if you what you qualify for and how much. Next slide. And so I just mentioned here a little bit, just so that folks have that extra knowledge about TASC. Again, they're on North 6th Street. They're usually open Monday through Friday from 8 a.m. to 4 p.m. It's a walk-in. It's a first-come, first-served basis, and so we tell people kind of get there. If you can get there a little bit before 8 o'clock, that's great. You'll have to wait to be seen, but that service is available for individuals that maybe can't afford treatment on their own. There is a hotline service after hours that is there that people can access if it's on the weekend and you really need to get a hold of somebody. There is that Drug and Alcohol Center, and their hotline is located there. And the Council on Chemical Abuse, last but not least. As I mentioned, we are your bridge to drug and alcohol resources. Having said that, we're located in Reading on Penn Street. Our office hours are from 8:30 a.m. to 5 p.m. We have a couple different websites, www.cocaberks.org. We also have a website, www.recoveryandme.org. And that's really a pathway for individuals to kind of get some experience, strength, and hope, maybe even some information about what's happening in their community as it relates to meetings, where it might be going on in terms of some alcohol and tobacco-free events. But Recovery and Me is really a great avenue for people who are currently in recovery, just to kind of help how to sustain themselves. Also, just I didn't mention in the PowerPoint, but just to kind of put a little plug for our resource, our library resource that we have at our office that has a wealth of pamphlets and literature, everything from how to help somebody that's newly in recovery to where might be the next Al-Anon meeting be located in our community, to some videos and books that you can actually sign out. And so we do encourage folks, it's open to the public, that you can come in and stop by and see what's in our resource library and ask questions. I will be around after our forum this evening, and so if you have any specific questions, I'd be more than happy to answer them for you at that time. I am just delighted to see the number of faces here, the signs of hope that exist for Berks County. I've been a Berks County for the last 25 years, and I would not want to be a resident anywhere else in the world but Berks County, just because of the wealth and the depth and the care that exists here for people to get well. So God bless each and every one of you, and have a wonderful evening.